Did you know that the biggest causes of head and neck cancers are alcohol and tobacco use? In fact, up to 75% of all cases are due to these two things. Another more recent factor is the human papillomavirus, or HPV. HPV has been found to be associated with many cancers, including cancers of the throat, tongue, and tonsils. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Dr. Kavita Patani serves as a head and neck surgical oncologist. She's part of the head and neck cancer specialty section at UF Health's Cancer Center, Orlando Health. And she's here to start our conversation about head and neck cancers. Thank you for being with us, Dr. Patani.
Thank you for having me.
I understand that the head and neck cancer subsection of UF Health is the busiest. Why is that?
So it is the busiest clinic and the busiest section at the Cancer Center. It doesn't quite conform with the statistics, because usually when we think of cancers in the general population, we think of breast cancers and lung cancers and ovarian and prostate cancers. But head and neck cancer only comprises 3% of the total cancers diagnosed in the United States.
So this is going to sound like a duh question, but what specific area of the body are we talking about that you deal with? And you can demonstrate too.
So usually we'll talk about clavicles and above.
So kind of upper chest.
So your clavicle, which is your collarbone,
okay,
and above. So things that include your throat, so your throat cancers, your voice box, your oral cavity, your ears, your skin, your thyroid gland, your sinuses. Those are the main cancers that we'll deal with.
I didn't hear you say brain.
It does not include your brain, which can be a misconception when we term it a head and neck cancer, but it's including the brain.
What are the leading causes? We heard alcohol and tobacco use. That was a little surprising.
Yes, so alcohol and tobacco are the most common risk factors for head and neck cancers. There are other risk factors that are on the rise, at least in terms of awareness, like the human papillomavirus. So HPV is very commonly discussed in the media now, but the main source usually is alcohol and topbaco.
What are the cancers that you see most often as a cancer surgeon?
So oropharyngeal cancers, which
oropharyngeal.
Yes,
Translate that
oropharyngeal.
for
So
us.
that is throat cancer essentially.
Okay.
It includes your tonsils, your palate. It includes the back of your tongue. So those are the most common ones that we'll encounter. They can be as a result of tobacco use or as a result of the human papillomavirus. Other cancers that we'll see very often are oral cavity cancers, so that's the front part of your tongue. It includes your cheek, your jawbone, for the most part, and then also throat cancers. So throat cancers that are referring to your voice box and not necessarily the back part of your throat.
Are there some people who are more prone to developing these kinds of cancers than others, or is it more related to behaviors?
No, there is a predilection. So the African American population, males, there's a predilection in terms of age as well, so above 50. And then risk factors that we've discussed, things like alcohol, tobacco, viruses, not just the human papillomavirus, other viruses as well that can cause nasal tumors, and then sun exposure, so skin cancer is a huge part of head and neck cancer as well. And then genetics plays a small part of it as well.
So what signs or symptoms should someone look for to let them know maybe they should talk to their doctor about getting checked out
Yeah,
more
this
thoroughly?
is very important. So masses or lesions that persist, that's number one. A lot of patients will come into our clinics with neck masses. So, they'll have a lump in their neck. They'll think that it's lymph nodes. They might have gotten sick, might have had a little infection, upper respiratory infection, or a little fever. But if it persists longer than a few weeks after you've been treated with antibiotics or such, it needs to be worked up further. Same thing with lesions that may occur in your mouth or the back of your throat or anywhere else that persists, things that ulcerate, that don't go away.
When you say ulcerate, you're talking about sores that don't heal.
Yes, that's exactly right.
Okay.
So,
what age groups are you seeing most often in your practice?
more commonly, we were seeing 50 and older, but now with the awareness of HPV, and we're able to differentiate patients that are actually in a younger population between the 30s and 50s that are coming in now that are diagnosed with oropharynx cancers.
Does that surprise you that you're seeing younger and younger people?
It doesn't. I feel that more and more culturally, maybe tobacco use may be on the decline.
And we're not just talking about cigarettes.
We're not. We're not.
Snuff, chewing
tobacco, betel nut
Okay.
use. So all
So
of
just
those are-
because you're not a smoker doesn't mean you can go,
No,
you
that's
know,
correct.
not
That's
at
correct.
risk.
Right. And even secondhand smoke, and we talk about that all the time. So
What about screenings? How does one screen for head and neck cancer?
there's annual screening that's done nationally, and that usually occurs around April or so. But there isn't actually a head and neck screening per se that's done, in a certain population. So it's not like getting an annual mammogram or a pap smear or a colonoscopy or something like that. So there's nothing defined as such. However, again, if you have those risk factors and you're having any symptoms or any kind of persistent issues, it needs to be looked at. So.
Would someone who, say, has a dry mouth all the time or a cough all the time, is that something that they should kind of check a little red flag by?
Yeah, the cough more so than anything, because it may be an indication that you either could have a lung problem, a lung issue, or you could have a head and neck cancer. For example, a cancer on your vocal cords or your voice box. So one of the presenting symptoms for those patients is changes in your voice or a chronic persistent cough.
So what questions should I ask my doctor if I'm not sure?
Basically, if things aren't resolving, that should be the part that raises the red flag. So if you have those sores, if you have a lesion and it just isn't going away and you're on your first, second, or sometimes even third and fourth courses of antibiotics, we'll see patients that are chronically treated and the symptoms or the lesions are not going away. So those are things that actually will spark concern.
Okay. Any final words that you'd like to tell people who just say, oh, it's no big deal. I've been, this lump has been there forever. I'm used to clearing my throat all the time.
Yeah, in our practice especially, we see a lot of patients that come in with advanced cancers. And I think awareness is a huge issue, especially with head and neck cancers, because it's not out in the media as much as some of the other cancers are. So yes, being aware of some of those symptoms, that it's not normal to have a mass or a lump in your neck or a mass or a lump in the back of your throat or mouth that's going to persist. And to make sure that they're asking their doctors or seeking a more specialized opinion.
So don't assume that it's minor.
Right.
And don't be afraid to ask the questions.
That's correct.
So what I'm hearing you say is advocacy, being your own advocate, is a huge, huge determinant as to whether you will actually Survive. What are the survival rates? That's the one thing we didn't talk about.
So for head and neck cancers, they'll vary just because of the fact that the subsites that we treat vary.
Okay.
So there's skin cancers, thyroid cancers that may have a pretty good prognosis
So
from a
ask your
cure rate.
doctor.
Yes.
Okay, Dr. Patani, thank you for being with us.
Thank you.
We will be back right after this. Don't go away. We're continuing our discussion about head and neck cancers with oncologist Dr. Rafael Toro Serra. Thank you for being with us.
My pleasure.
Now, a few minutes ago, we heard about the HPV virus as one of the risk factors for head and neck cancer. Can you tell us what that virus is and how does one contract it?
So the HPV virus, it's been mostly described in cervical cancers. In females, that's why women get their pap smears checked. Most recently, in the past 10, 15 years, we've noticed an increased rate of HPV-related cancers in the head and neck. So HPV is a sexually transmitted disease, and in the head and neck, you develop a cancer years after the exposure.
Okay, so this is a very slow process. It's not
Correct.
something that is rapidly advancing. Is that the case with most head and neck cancers, that they develop very slowly, or depending on where they are, is it a rapid situation?
It depends on where they are, if the response on how quick they grow, on how fast they develop into something that is more noticeable.
Which ones are the fastest growing?
So squamous cell cancers are rapid growers.
What is that? Is that skin cancer?
That's a type of skin cancer, but it's a cancer of the lining of the inside of your mouth and nose that causes most of the head and neck tumors.
Now, that's not an area we check a lot. So how do you find out that someone has that cancer?
So usually the patient is the one that starts complaining about something, and they start going to different physicians. Sometimes they just don't notice anything, but they go to the regular checkup with their dentist, and the dentist picks it up, and he's like, looks at it, doesn't like it, either biopsy it at the office, or he refers it to a head and neck, an ENT physician for further follow-up.
So do dentists do the screening, or they just refer patients to you?
Some do both.
Okay.
Do screening, and they just see this patient, look into their mouth, and on their exam they find a new lesion, and they're
there's some-
suspicious about it, and then they get the ball rolling.
How are these cancers treated? If someone comes in, they're presenting symptoms, or they're referred by a dentist, what happens once they walk through your doors?
So depends where it's located.
Okay.
Depends what treatment.
What's the most common?
So most common these days it will be the oropharynx, throat cancer.
Okay. What happens when they walk in the door? What's the treatment process like?
Treatment process would be getting a biopsy to get a diagnosis. Once a diagnosis is obtained, we refer them for further treatment. And that treatment can go from surgery to radiation to a combination of surgery, radiation, chemotherapy, whole spectrum.
Now, we hear in a lot of cancers that the cure rate is pretty high, or rarely does the patient come back when the cancer, because the cancer doesn't return. Is that the case for most head and neck cancers?
It depends on location and the stage where the patient shows up. You know, advanced stage cancers have a lower cure rates. Lower stage cancers have a higher cure rates.
What determines what a lower stage is?
Depends on head and neck, it depends on the size of the tumor and if there is any lymph node involvement or no lymph node involvement.
Is there a genetic component if a parent or a grandparent had, say, thyroid cancer? Are you more prone to develop it? You know, we know there's that connection with breast cancer. Is the same true for cancers of the head and neck?
It is in some of them. For example, thyroid, it can run in families and it's treated accordingly, which most of the time for thyroid cancer, the treatment of choice would be surgery.
Okay. Clinical trials, where are we in developing new ways of treating cancers of the head and neck?
Well, there's a few trials that we run off for head and neck squamous cell cancers.
You said that squamous cells, what are those?
Those are types of cells of tumors that overgrow because of persistent inflammation or irritation of an area.
Okay.
So your body tries to create a barrier, so it makes your lining a little thicker and thicker and thicker.
Okay.
And it becomes to a point that the cells become malignant because it's trying to protect you, but it fails the purpose.
So tell us about the clinical trials. What's going on right now?
So there's a few clinical trials on head and neck squamous, as I just mentioned, with radiation and chemotherapy options.
Are those the most common methods for treating cancers of the head and neck?
Some of the most common,
Okay.
yes.
What are some of the other options?
Surgery would be the other option.
Okay, so surgery, chemotherapy, radiation. In your experience as an oncologist, what have you found to be the most effective for perhaps the most common types of cancer? You mentioned thyroid cancer, and we know that skin cancer is also under the umbrella of cancers that you treat.
Correct. So most common, if you take skin and thyroid away, then will be oropharynx, which would be the back of the throat.
Back of the throat and the mouth cavity.
Into the oral cavity.
Okay. What advice would you give people who want to start checking themselves out more thoroughly? What can we do to help you?
So one, if you have HPV, it doesn't mean you're always going to get a cancer. Two would be if you have something in the back of your throat, persistent cough, discomfort, pain, a lump in the neck that doesn't go away with standard therapy of a primary care physician, by that I mean antibiotics. After 2 or 3 courses, you still have it, you should go to someone that works on this on a daily basis to give you a better picture of what might be going on.
Okay, so take charge of your own health.
Correct.
Dr. Torresera, thank you for being with us.
My pleasure.
We will be right back. There's more. We've learned that almost 8 out of 10 cases of head and neck cancers are caused by alcohol and tobacco use, so something to take note of. We've also learned that you can't be too careful when dealing with your health. You have to become your own best advocate because we want you to stick around to have more healthy connections. I'm Annetta Wilson. Thanks for joining us. We'll see you next time.